name is Justin Adler. I'll be presenting today why free healthcare benefits people. All right. So I believe that people shouldn't have to not pay rent. I believe people shouldn't. I believe people shouldn't have to worry about rent and then also have to pay their health care. There's hundreds of other countries throughout our world that don't have to pay health care and it's free for everybody, and I believe they should bring that into America. Over 30 million Americans lack health insurance. Medical bills are the #1 cause of bankruptcy. Free health care would reduce financial stress and save lives. And like I said, I think America should implement a free health care for all Americans. All right, so free healthcare saves lives. Countries with publicly funded healthcare see average life expectancy around 76 years, about 10 years longer than countries such as 66 years. Even when you're controlling factors like poverty, sanitation, publicly funded healthcare remains strongly associated with longer lifespan. So if you compare us, like the US to Canada, low-income Americans were more likely to report poor self-related health than Canadians, indicating that access via universal coverage reduces income-related health. But yeah, as you see on my chart, the US is most up there with that. All right, so my supported evidence to back that up, I believe the universal healthcare system leads to healthier populations. People receive treatment earlier rather than waiting until illness becomes severe, which is what we shouldn't be doing. Preventative care loss, long-term costs, and mortality rates. And then I looked up this fact. According to the World Health Organization, countries with universal healthcare have a higher average life expectancy, lower rates of preventable diseases, overall better health outcomes, because citizens can receive their care earlier, and they also don't have to worry about the financial that comes with it, all the problems with that. So I put down here just like the average life expectancy, the light blues, the countries with universal health care. As you can see here, they have a better long term of life, I believe. All right, moving on, we have free healthcare, reduces financial burden. Medical debt pushes families into poverty. Over 100 million Americans have healthcare-related debt, and free healthcare can prevent bankruptcy and homelessness. So I put a little chart right here for you guys. It's the share of U.S. households with medical debt by householder age. Free healthcare improves workforce productivity. So healthier workers, fewer sick days, better for the company. Access to mental and physical care improves performance, and companies benefit through increased retention plus efficiency. So pretty much everything I've said is kind of broken down right here for you guys. So that's the benefits of employee health and wellness right there for y'all. And then the company's benefits and increased retention and higher efficiency, like I said. Now there's a counter argument with this. What would the counter argument be? Some people argue that free healthcare is too expensive. However, countries with universal care spend less overall. Also, preventative care costs less than emergency treatments, and lower costs long-term outweigh initial tax funding. But also another chart for you guys. Some argue, that's too expensive, but I think it actually has better real world examples. So obviously we're not in the red because we don't have free healthcare, but countries like Canada, UK, Sweden, and France, they all have universal free healthcare. They all maintain strong life expectancy, better patient outcomes. That's just like a whole bill that they don't have to, deal with later on in life, or when you go to the hospital, the doctor's offices. Obviously we have insurance, but the insurance won't cover the whole bill. So I just think overall it's better for the US to maybe one day implement that for everyone. All right, to sum it up for you guys, free healthcare is not just a policy, it's a right. Saves lives, cuts debt, strengthens our workforce. Other nations prove it works, as I just showed in my last slide. And it works. We can do. There's a little chart right here. So I put in the orange without universal health care, and the blue with universal health care. And my citations. And that is it. Thank you guys for joining.